Okay, hi everyone. That's why I can turn it. I know it's late, so most people are tired, so we'll try to get through this pretty quickly. So today we want to talk to you about GPSSample, which is really a tool that we felt has a lot of relevance for healthcare, but also a lot of relevance for non-healthcare context. And so by definition, my name is Joel, and my colleague is Amber, and we both work for the US Centers for Disease Control based in Atlanta. And this work is really a combination of multiple teams. We are working with the Georgia Tech Research Institute that has really been leading a lot of the development in collaboration with other colleagues from CDC. Okay, so let's get into it. So GPSSample. So this is really an Android-based mobile application that is used for enumeration, sampling, and navigation. And this really tries to streamline the process that you would see when trying to conduct a rapid assessment. And so for this context, you will see us make a lot of reference to household surveys, but these can be used beyond household surveys. Household surveys are just an example of how the tool can be used. So the primary use of the tool is enumeration or listing, as some of us might call it, sampling, and of course navigation back to households, and all of that can be done in one single visit. Now, this became really important for public health because in 2018, the World Health Organization, WHO, sort of released a guide that said for you to be able to conduct a household survey, you have to list all the households within the enumeration area or cluster before you can then take a sample and then do a coverage survey. And so this tool has sort of been very useful in supporting that process. It is Android-based. Currently, we have it translated to 6 different languages. And we have tested being able to push the data from GPSSample into ODK Collect and also Kobo Toolbox. The goal is for this to be open source and free. And so this is built using the Kotlin language. And we do hope to have the codes released in 2025, hopefully early first quarter of next year. And so one of the key features of the tool I wanted to highlight is one is, for the most part of the tool, it works offline, and I'm going to explain what that means exactly. But when the data also, the application also has the ability to share data across multiple devices using like a local hotspot. And right now it has the ability to do 2 types of sampling, which is a simple random sampling, but also like the cluster sampling. So let me kind of describe to you the sort of how it works. And so you often have 4 main personas or 4 main roles within the app. I'm going to start with the admin. So the admin is sort of the first person who handles the app, and they have the responsibility of building a configuration. And that includes within that a study. So here you determine things like, what is the the date, format, the name, every security encryption, all those kind of things are sort of built within the configuration. And then you create a study. And then within the study, you can then decide what types of preliminary questions do you want to collect to be able to support your sampling. Now, once the configuration is done by the admin, the data packet is then transferred to what we call a supervisor. So the role of a supervisor is really to so you have one admin, and then you can have multiple supervisors depending on what type of activity you're conducting. One critical feature of this app is how you are able to map your boundaries. And so here you have 4 types of boundary creation methods. And so the first one is in a context where you can actually just import a GeoJSON file, which is the first one. The second one is when you know you have a base map and you know your area, you can literally just drop pins around the perimeter of your cluster. The third function is in cases, which happens a lot in many of the settings we work in, whereby there isn't a defined boundary, or you have challenges with even defining boundaries across 2 communities, your enumerator can literally walk around and define the boundaries based on local knowledge. And so that's what you have in the third example. And so most of what we're going to show you here today will focus mainly on the third example. And then for the fourth one is literally you can add a single point and then you designate your cluster size. And so once the supervisor gets the app, the particular configuration, that can then be distributed to the enumerator. So the enumerator, like I said, for this example here, is walking across the boundary. So you go across the boundary of the cluster, and then you define the size. And then you can then go house to house and then collect information. And sometimes you want to limit the information to just the most critical information that is required for your sampling. And then once that is already done, the data is then transferred from the enumerators back to the supervisor. And as you can see on the first slide, the supervisor then has a list of all the houses that have been enumerated. The second slide kind of shows you where they are located on the map. And then the supervisor can then do what you call a sampling. So you can do a sampling defined by some of the preliminary data you've collected. And once the sample is done, the supervisor can then share that data back to the field or data collectors or the field teams. And you can see here on the last screenshot, it just shows you that this supervisor has designated to collect data across 2 teams. So he's divided the sample data across 2 teams for them to then conduct the actual field survey. And then for the field teams, they then go back to those households, and the app is able to navigate you back to those households, giving you direction. Now, it's possible that the teams that the teams that conducted the enumeration are not the same ones that are going back to conduct the field surveys. Okay, and then once that is done, and then you get to the household to conduct the field survey, GPSSample is able to then launch and open the survey app. So GPSSample does not replace ODK or Cover Collect. It only serves as a complementary app and does some of the front end work. And so the data, like the unique ID from GPSSample, can then be pushed directly into tools like ODK or Cover Collect. All right. So I'll pause there and hand over to a colleague, Amber, who will then talk about two use cases or examples in terms of how we've used it in Kenya and India.
Thank you so much, Joel. So here on this map, the 2 countries in yellow are India and Kenya, where we'll focus the rest of our time. But you'll see in green, these are all of the countries where we've done in-person trainings. This has included the US, Haiti, this week here in Brazil, Kazakhstan, the Democratic Republic of Congo, and Mozambique. And we hope to expand this map. So we're excited to be here. We hope that, yes, please reach out to us. I also want to say that for DRC, they've done 4 implementations of GPSSample, but we had to focus on our first 2 use cases in India and Kenya. So these are some additional ways you can use GPSSample, rapid assessments. We also think they'd be very useful for outbreak investigations, but we haven't had people use it yet for that purpose. So let me tell you a little of the story about using GPSSample in India. We started with version 64, and our objective was really to, with the WHO India colleagues, help them complete a coverage survey, which was measuring measles and rubella coverage in children ages 2 to less than 4 years old. To do this, we went to New Delhi and conducted a 3-day training. Afterwards, we went and all together, and our WHO India colleagues then led the training in Mohali, which is another district. The overall pilot and implementation of the 3 districts took place from February through July of 2024. So what did we need? What were some of the basic requirements? The first was that the India team requested that we develop GPSSamples so that they could walk a cluster boundary and generate the limits. As Joel mentioned, we did have the ability to tap on the map and add points, but this was not, only about 20 to 30% of the clusters had any maps, so it was really important that we added this feature, and teams very much appreciated it. So to test in Mohali, we asked for an area that had that was urban and that had a high-rise apartment building, because we weren't sure what that was going to be like. The first challenge for the teams was how to walk the cluster. So between points 1 and 4, you actually can't walk between those. So this took a little bit for the team to decide how do you walk it so that GPSSample will create that line between 1 and 4, but it took a bit for them to figure that part out. Also, a note is that you can enumerate outside of the boundaries of the cluster, which was very, very helpful. And then teams decided that they were going to take a point outside of those multi-household structures, go up on the 5th floor, and start enumerating down. So having a standard SOP that they wanted was really important. We learned a lot through this piloting phase. So you'll see here some of the things we found. One was we had this really long UUID, which was like 36 characters, which meant absolutely nothing to the teams. So what we discovered is that we needed to use the household serialization. So using numbers 1, 2, 3, 4, 5, it made it much easier for teams to know that they were actually at the right household. And those teams were using chalk to identify which houses they had been to. So this was just really a critical feature that we updated. Second, through this piloting, we added summary statistics. So before, you can see on the left, there was no summary info in the app. During our Mohali pilot visit, we added cluster level summary. So the total number of houses enumerated, sampled, and collected. And by the end of the field visit, we had also added in a summary of all of the statistics of all of the clusters. So as a supervisor, you could perform in-field verification of your teams. So the survey itself, you'll notice the version here, was we had a list of features we needed to go home and update before they could use the app for real implementation. It took place with GPSSample versions 90 through 92 and was conducted in 3 districts. So these were 3 separate surveys with 320 clusters. There was 1 admin in New Delhi, and as you can see, 25 supervisors and 57 enumerators. The enumerators also did the data collection role, and they enumerated over 30,000 houses. Some of the additional feedback that we had received from the India teams is that this really helped them increase the data quality of the survey, and in the future, they recommended adding more training days, both for supervisors and enumerators. Here you can see some of the things they wanted us to update in GPSSample. All in black we fixed. So there was an issue we discovered that the app was crashing because the entire database was being transferred back and forth, and that was immediately fixed. So now it only sends 1 cluster at a time, the one that's needed by the field teams. We are still working on the one in blue so that when you tap on a file from GPSSample, it is able to recognize it. So that is there's a lot more, but this is what I wanted to highlight about the India use case today. And our second big use case was in Kenya with the SMART team. This was a feasibility and acceptance piloting with Action Against Hunger US and Action contre la Faim Canada. It happened in April of 2024, which you can see is within the same time as our first pilot. But the SMART survey methodology is really to measure the nutritional status of kids under 5 and the mortality rate of a population. It's used a lot in humanitarian settings. This was not piloted in a humanitarian setting, but it was integrated with a SMART survey. So the team, what they did do for us is they had daily user questionnaires that they sent out to the teams, and then they also did focus group discussions at the end of the survey. So it was very helpful. So let's talk a little bit about the GPSSample pilot process. First, all of the teams went out to the clusters and they walked the boundary, adding points and saving the cluster boundaries. Then, within the same cluster, they listed all the houses, and they decided to do this all at once within the first 4 days. We had expected them to map and list 1 cluster and then do the survey, but they tested that and they thought this would be a better approach. Second, the supervisors drew the sample for the clusters, and then third, they had the teams return to the selected houses to lead the SMART survey. This is a map on the right of the Meru County. It's a very rural area. So of the 55 clusters, 51 were rural areas. So it was a very different use case that was tested in Kenya than in India. And the darker green here just shows mixed farming. So this is a huge farming community. Some of the features that the teams really liked in GPSSample was that how easy it was to navigate back to the selected houses. And then they liked that after you pressed after you mark the status of a household as being complete during an enumeration, it turns green. If it's incomplete, it's red. And then also at the survey stage, the houses start as blue, and if you mark it as complete, it changes to purple. If it's incomplete, it's orange. So this was helpful. And then they also reported that the ability, that because GPSSample, you have to be within the exact 30 meters of the household to edit or launch the survey, this was incredibly helpful. And they reported that it helped them to have confidence in the data and to know that they weren't going to bias the sample by selecting, for example, a household that is nearby that has kids. So additionally, they said there was no need to collect this third question on the household description. This is often reported by the WHO's guidance that this is a critical feature that you should add. But they said that there wasn't enough to differentiate the houses, so it didn't make sense to add. They also requested more time for training. And they thought that the process of walking the boundary took a long time. They said, can we skip that? Which is why that fourth method that you saw was added. They also requested that if they had to go back to the same household, to be able to relaunch that same questionnaire in ODK. And then they did report to us that Mapbox didn't have the best base map images for this area. In fact, it was pretty much a gray map in most of these clusters. So it is something that we're working on as well. So I mentioned that the app has gone through a lot of changes, and these were the key features across this time that we thought were important. We're now on version 106. So what does our future look like as the GPSSample app team? Well, first, we're happy to report that you can now look at our website, launched last week, gpssample.org. And here you can find user guides, links to all these training videos. Please connect with us. We very much want to develop a GPSSample community. And the app is freely available now on the Google Play Store as well. But we need your help. We need your help to increase the GPSSample user community. We'd love to add more use cases, to discuss use cases. And in 2025, our goal is to introduce and add stratified sampling and subset sampling. So you'll have more sampling capacity coming soon. We are also looking to establish a community of Kotlin developers. And also, so this is really one of the primary reasons why we're here, to find you, or these people. Also, we're looking for to add turn-by-turn offline routing, especially important for remote areas, as well as to identify maybe the best platform to tile OSM data in GPSSample. And then finally, as Joël mentioned, we're hoping in 2025, early 2025, to release our GPSSample code base and documentation. So with that, we really want to thank you all for being here, and the FOSS4G Belém organizers, and all of the other individuals and organizations here, and open it up for questions.